Hello, my name is Eric Bricker and I am the Chief Medical Officer of Compass Professional Health Services. Compass is a healthcare consumer advocacy firm. We provide tools and support for about 1,100 employer clients across the country, and I'm a general internist, primary care physician, and today I'm going to speak with you about what you need to know if you're going to see an orthopedic surgeon. Now, an orthopedic surgeon and an orthopedist are the same thing, and it's a doctor that takes care of bones and joints, oftentimes aches and pains related to your neck or your low back or maybe your knee or hip or elbow joints. And so when you're going to see that type of specialist, there are things that you as a consumer need to keep in mind. Okay, the first one is that if you have any pictures taken of your joints or your back previously, it would be good to take copies of those pictures to the orthopedist. Now, they could be on an actual disc, it could be a digital image, or it could be the actual film from either an X-ray or a CT scan or an MRI, but orthopedic surgeons really appreciate being able to look at images that have been previously taken. So please take those with you. So number two, know that if you bring images with you, or even if you don't have any previous pictures taken, that it's highly likely that when you go to see an orthopedic surgeon, that he or she will then order you for a subsequent imaging test. And so that imaging test is likely going to be an X-ray or an MRI or a CT scan, usually of the bone or joint that's been causing you problems. So if you've been having knee pain, they might order an MRI of the knee. Or if you've been having back pain, they might order an MRI of your lumbar spine or your low back. And so what's important to know there about that imaging is that most likely the cost of that imaging will not be included in the copay that you paid to see the doctor. So if you paid, let's say, $50, for example, to see that doctor, if they order you for an X-ray or an MRI or CT scan, the cost of that scan is most likely not going to be included in that $50. And so if you have a deductible in your plan, then you most likely are going to have to pay the cost of that. What's important to note there too is that even if the doctor has a scanner in their office, that it likely will not be included in the copay. So you're still going to have to pay an additional amount, which is fine, but it's just important for you to know that in advance. It's also important to know that where they refer you to could cost you upwards of $3,500 for that MRI or CT scan, or at some facilities it can be as low as $300. So there's actually a huge variation in the price of what that image might cost. And so you do have options in terms of where you might be able to go to get that image done. And so it's important to work with your physician's office to see what different hospitals or facilities they refer out to, and then compare prices. And oftentimes the image quality of a lower cost facility might even be higher. So you're not necessarily sacrificing quality to find a more cost-effective place to get your MRI, CT scan, or X-ray done. Another important thing that's important for you to know about a visit to the orthopedic surgeon is that oftentimes going to see a physical therapist is an effective way to deal with aches and pains. And actually there's some guidelines that actually show that for things like low back pain, it's actually recommended that you see a therapist before actually getting an MRI even done. And so it's important to keep in mind that maybe just physical therapy would be a good option for you, either before they even do an MRI or maybe subsequently after. And the last thing that's important to note when you're seeing an orthopedic surgeon is that if you are recommended for surgery, so very common surgeries they might do would be carpal tunnel release or arthroscopic knee surgery, or maybe even a knee replacement, or maybe more significant surgery on the spine, is that it's very reasonable for you to get a second opinion. So if you ask 10 doctors the same question, oftentimes you'll get 10 different answers. And so there's a lot of subjectivity around deciding, how to treat aches and pains specifically related to joints. And so it's very reasonable for you to want to get a second opinion to see if that surgery is right for you. Maybe a different surgery is better for you, or maybe some other approach like doing a steroid injection or more therapy or what have you might be more appropriate. And so, at the end of the day, if you still need to go have your surgery, it's completely fine. But that way you've sort of, validated that opinion by more than one physician. So in closing, these are some very common things that we at Compass, as healthcare consumer advocates, do when we help our members find orthopedic surgeons. And we literally help 2,000 to 3,000 people a week find different types of specialists, including orthopedic surgeons. And so whether you're using Compass or trying to find an orthopedic surgeon on your own, these are some important things to keep in mind as a healthcare consumer so that you can receive high quality care and do so in a cost-effective way. So thank you so much, and if you'd like to learn more about the different types of physician subspecialties and how to find different types of physician specialists, then please follow the link at the end of this video. Thank you so much.